Good afternoon, everyone. My name is Dr. Trish Sipley, Director of Professional Education and Research for the Central Jersey Family Health Consortium. I would like to welcome you all to our series of webinars focused on Maternal Health Awareness Week in New Jersey. This presentation is one of 4 being sponsored by CJFHC. Today's presentation will be Stop, Look, Listen campaign, why this is so important to maternal health. It is with great respect that I introduce Robin Duria, MA, RNC, APN. Robin is the Chief Executive Officer of the Central Jersey Family Health Consortium, a 501c3 not-for-profit agency. The consortium is a regionalized network of agencies and providers involved in the delivery of perinatal and pediatric services in central New Jersey, whose mission is to promote an equitable and healthy future for families through services, advocacy, education, and collaboration. Having administrative oversight of the agency, she oversees a variety of community-based initiatives that serve women, children, and families throughout New Jersey, including home visiting programs. Robin has over 35 years of experience in maternal health in a variety of roles, including perinatal clinical specialist and director of women's and children's services, as well as faculty of pediatric and maternal child health nursing in a number of baccalaureate and associate degree programs. She is the immediate past New Jersey chair for the Association of Women's Health Obstetrics and Neonatal Nurses, known as AWON, and was a member of their expert panel on maternal mortality. Additionally, she is the co-author of the New Jersey Perinatal Quality Collaborative, co-chair, as well as co-partner through the American College of Obstetrics and Gynecologists for the Alliance for Innovation in Maternal Health, otherwise known as AIM, a national quality improvement program aimed at improving patient safety in obstetrics. Robin has been integrally involved in developing and promoting this quality improvement work, not only locally but nationally, having published about the patient safety bundles in peer-reviewed journals, and speaking about efforts to reduce maternal mortality and morbidity at the state and national level. Please join me in welcoming Robin Duria.
Thank you so much, Trish, and it truly is a pleasure to be with you today. I'd like to just share with you some thoughts about why maternal health awareness is so important, not only to you and I, but to all of the women and families and pregnant persons in New Jersey. So welcome to our 4th annual Maternal Health Awareness Day. Maternal Health Awareness Day is celebrated on January 23rd of every year. And we are thrilled that we just have extended it, frankly, to a week. This slide, I'd like to give you a little background information. It's one of my favorite slides. It's a little bit dated, but it really shows us how far we have come with reducing maternal mortality within the United States. And this graph is very clear in how we have been able to decrease maternal mortality. And where you see that precipitous drop, you can equate that to the advances we made in medicine, particularly in the area of infection control. And that is where we saw the likelihood of dying from having a baby to frankly, decrease. And really, it was around the 1980s, as we were going into the 90s, we got down closer to 0 than we had ever been before. However, it's not as good as it looks. And in this particular slide, you can see how we actually fare against other industrialized nations throughout the world. In June of 2019, HRSA brought together leading subject matter experts from within and beyond the US borders to highlight different innovative strategies in reducing maternal mortality. And having the privilege of sitting amongst these people from different countries such as Brazil, Canada, Finland, India, Rwanda, and the United Kingdom, as well as representatives from the World Health Organization, you could actually hear some of the stories that were told about women and about their issues with morbidity and mortality. But what was incredibly surprising to some of us in the room were some of the very simple efforts that had taken place in these countries that had dramatically reduced their maternal mortality. Because obviously, for as well as we do in so many aspects in this particular area, there's still much work to be done. We know in the United States that nearly 700 women die annually of pregnancy-related complications, and this is tracked through the CDC. And the program that they use is the Pregnancy Mortality Surveillance System. It's the most accurate source of national data that we have right now on pregnancy-related deaths. All of these women are dying during a period when they should have a lot of support. They should have support not only within their family, but support in healthcare and their surrounding communities. Here you can see New Jersey and how we rank. And this is a sliding scale of where New Jersey is compared to the United States. And it's over a few year period as noted above. We still rank near the bottom of all of our states. And many of you on this webinar have probably heard the First Lady, Tammy Murphy, talk about where we are in rankings anywhere, and it's noted around the 47th out of 50 states in maternal mortality. And when you look at the disparity in women who are dying, that is even more appalling. This has gotten national attention, and although we've been monitoring maternal mortality in New Jersey for over 70 years, we have one of the longest standing maternal mortality review committees in the country. We knew that there was more we needed to do, and raising awareness was one of those things. And frankly, it wasn't until 2017 that we really started to get a little bit more traction on the efforts that we were making within the state. In 2017, ProPublica started writing a series called the Lost Mothers series. And the first article, and you can see here a picture from that article, they highlighted the story of Lauren Bloomstein, a neonatal nurse who died from preeclampsia in the hospital where she worked. Lauren was a New Jersey native, and the hospital she died in was in New Jersey. And this is really what caught everyone's attention, not only clinicians, not only the community, but other stakeholders such as legislators. Following this first article, there have been a series of articles, not only in ProPublica, but in all the mainstream media, from the New York Times, across the board, local papers, national papers. And just in February of last year, there was again, a summary, and Nina Martin, who was the primary author of this series, continues to this day to keep in touch with those of us in New Jersey to see where we've gone, what we've done, and the progress that we're making. But I do want to share with you a story of a woman, Tara Hansen. It's the Tara Hansen Foundation that really provided the spark for us to move even further in the state. And partnering with Robert Wood Johnson Medical School, as well as Robert Wood Johnson Barnabas Health System, there was a program that was held. And I want to, if I can, play for you the YouTube so that you can hear Tara's story and understand why this has really been something that we hold very dearly, but has really provided us with the reason to continue on.
I met Tara when we were in high school. She was 16, I was 17. She was this warm personality that you wanted to be with, you wanted to talk to do things with, explore with. We dated for 8 years, and we got engaged, and by the time we were both 26, 27 years old, we got married.
I now pronounce you husband and wife. Ryan, you may now kiss the bride.
It was the quintessential American dream. She surprised me big time. I came home from work, and before I could really even say hello, she said, "Ron, I'm pregnant." We were both shocked, but happy. We began getting the house ready and just kind of getting a plan on the type of parents we wanted to be. Labor and delivery all happened pretty quickly, and the next thing I know, I'm holding my baby boy for the first time. I look down at Tara, she's holding him for the first time, and I remember saying, "What do you think he is?" And she goes, "I think he's a Brandon." I'll never forget that moment, looking in her eyes, the emotion and how proud she was. About a few hours after Brandon was born, Tara began to not feel well. She had some fainting issues that we were concerned with. We began telling our healthcare providers, our team. Before we left the hospital, we had asked the doctor, one last time, would you please check, make sure Tara's okay. She truly felt something was wrong. We went home, started to get settled in.
Hi, Brandy Bear. Say hello, everybody. Say I'm here.
We'd been home now for about 36 hours total. We're family, we're finally here. And she says, I have to call the doctor, I have to go in. Something's wrong. We ended up back in the hospital, and over the period of the next 2 days, her condition just kind of began to get worse and worse. She had an infection, and she had gotten to the point where it had spread throughout her entire body. And to watch the person that you love so much have to go through that and watch her just slowly become, almost incapacitated it's devastating. March 31st, 2011, she passed away early that morning. The thought that Tara could pass away from something associated with giving birth, it never crossed my mind. I learned about maternal mortality only because it happened to me. Tara was a teacher. She educated people, she helped people, and her legacy, in my mind, is best kept. It grows. If I can come out and I can tell what happened to her, it makes what happened to her matter. When Tara passed away, I moved in with my parents. It was the only thing I could think to do that would keep Brandon safe, keep myself safe. I remember asking my mom, saying, I need you to love Brandon the same way you loved me, because I can't give a mother's love. It was about 2 years where some friends of mine began to encourage me, saying, we knew Tara. We know she wants you to be happy. I met Mary on a dating website. I said, maybe there's someone out there who's been through the same thing.
I was originally married when I was 23 years old. 3 years after we were married, my first husband passed away from a heart attack suddenly. It took many years for me to realize that I needed to start dating again. So about 3.5 years ago, I filled out a profile online. And Ryan sent me a very short and sweet email. She's
this amazing woman. It's unbelievable to have been able to find someone to do life with again.
Ryan and I dated for 1.5 years before he proposed. He had Brandon propose with the ring and asked me to be his mom. So, you can't say no to that.
I love school. All
right, unbuckle. Grab your backpack.
I wasn't sure I could ever go through, having another child. And I meet this woman who has taught me how to live life again, how to love again. I wouldn't want Brandon to not grow up without a sibling. It's kind of my chance to have that life that I've always wanted.
Once I found out that I was pregnant, after knowing what happened to Tara, it definitely made me speak up more.
We told our doctors along the way, you need to be, ready for anything. Everything went great. Dylan came out 8 pounds, 12 ounces, happy and healthy. I remember telling her doctor after Dylan was born, I just said to her, please don't forget about her. I need you to be here for her. Life today it's everything I had hoped that it could be. Brandon loves Dylan. Their eyes lock on each other, and it's what I had always hoped for.
It's still so important to make sure that Tara and her voice don't go unheard. People need to hear, people need to know, and people need to see that this still happens, and giving women a voice in our country and all over the world is the most important.
Getting the message across about Maternal mortality it's incredibly difficult. People don't always want to hear it. You're having a baby. You don't want to think about death, but it doesn't discriminate. It can happen to anyone. Don't give up. If someone's not listening, if you can't get the attention you need, fight. Fight for it. Fight for each other, fight for your partner. Don't ever give up on each other.
So that gives you a sense of what brought us all together. And this is just a summary of what you heard. But what I will say is that as our group, and it was just a small group of folks that really got together after an initial educational program that was held in 2012 called To Heaven to Hold. That is where the idea of a campaign called Stop, Look, and Listen actually developed into the thought of Maternal Health Awareness Day. Senator Joseph Vitale was kind enough to listen and hear what we were asking for, and in June 2016, introduced the bill that actually would support an annual day of recognition. And Governor Christie signed that into law on May 11th, 2017. The program that is associated with Maternal Health Awareness Day. So it's not only the day. What was very important to Ryan and his family was that we talk about and design something that could educate clinicians on that stop, look, and listen piece, but also designed for women and families, pregnant persons, to know that they are the ones that should be empowered to be able to raise their voice and encourage them to really think about if they have a problem, they should go to the next step if they needed to. I'm always very touched by a quote that Ryan's mom has shared, and that is, no father should have to celebrate his child's birthday every year with the knowledge that this special occasion also marks the preventable passing of his wife. And it's those words that resonate, I know, with me, as every year we do that much more to get the word out on this particular campaign. So again, why are we doing this? We're increasing awareness of our issues in New Jersey to all. And there is a dual focus. In this particular case, we're talking about clinicians, we're talking about families, we're talking about other stakeholders that can make a difference. And this is for every woman, every time she's seen. So specifically for clinicians, the stop, look, listen is really, it's three parts, fairly simple, frankly. And the first being stop. If a woman does not feel well or believes something is wrong, we encourage clinicians to literally stop what they're doing. Stop typing in the EMR, stop, or EHR, stop writing on a piece of paper. Stop and really think about what they're saying, what the woman's saying. Don't assume that this may be a normal complaint that's associated with discomfort of pregnancy, postpartum, or anything to do with childbirth. To actually look at the patient, to conduct an examination, to be sure that there's no evolving problem. Again, not to assume. And I have to share with the group that we've been very fortunate to take this campaign and these very short lessons to medical staffs across the state, but also to our students, to residents in OBGYN, nursing students, public health students as well. And the third component of the clinician campaign is to listen, to actively listen to what the woman is experiencing, listen to her words, because the reality is she knows her body best. And don't consider that it's just normal. Rule out everything else. Now, for families, what does it mean? And for families, we're looking at focusing on empowerment. It was designed to empower pregnant women and their loved ones to address maternal health and safety and to speak up when something's wrong. If the provider is not addressing the issue, then go to the emergency room. Do whatever you have to in order to be heard. If grandma says, oh, that's normal, I felt the same way, but you know innately this is just not normal for yourself, take that next step. It's okay. And when we look at empowerment, what exactly does that mean? And these are just some thoughts on empowerment that I thought really described, particularly in this case, what we're looking to do. It's a practice that encourages patients to be actively involved. They're not bystanders to their healthcare. They're part of the healthcare team. It's to help patients really develop a self-awareness, to be able to promote understanding so that patients can be equal partners. If they don't understand the terminology that's being used, then the patient needs to speak up and say, I don't know what that word means. We may assume that they do, but again, we fall into that same trap of assuming and not really knowing. And the other piece to this, which I think is critical, it puts the patient at the heart of health services. They are the center, and we all gravitate around them to ensure that their health is of utmost or is the primary driver of what we're doing. So the aim of empowering patients is really to help them develop that self-awareness, to be able to perform self-care and to understand what is happening so they can make informed decisions. Always putting them at the heart of health services will really maximize any benefits that they get from that. And that really is what we want to do with this campaign. And why is it so important? Because often the woman knows if there's something wrong. And I'd like to share with you some tools, some different programs, some groups that actually help to promote and empower women in their decision making. This particular tool is called the Save Your Life tool, and it speaks to post-birth warning signs. The leading causes of severe morbidity or complications following childbirth and or mortality, why people die, are actually captured on this particular tool that's used. This is what's used by almost all our hospitals in New Jersey and frankly across the country now, if not this tool or one similar, that really speaks to what are those signs and symptoms that I need to be worried about that can in fact cause severe illness to me. Because we know if you get through childbirth, it doesn't mean we're all out of the woods. That when we look at maternal mortality, nearly 1/3 of all deaths occur after the baby's born. So, and that's up through 1 year post-delivery. So it's important that women have this information before they leave the hospital and they know what it is they need to look for. This form actually encourages patient empowerment. Now, the CDC actually spoke with New Jersey as they were designing this particular campaign. This campaign is very similar to the Stop, Look, Listen campaign that was developed here in New Jersey. And in fact, when this campaign was rolled out within the past year, Dr. Wanda Barfield, who is the head of the CDC, actually in her opening remarks spoke about the Speak Up campaign in New Jersey. And we have to say that we are incredibly grateful that they heard and no pun intended there, that they actually heard what we were saying and saw the value in the Stop, Look, and Listen campaign. And although we're incredibly proud of this, we know that there's still more to do. And I urge you to go to the CDC website and just type in Hear Her. The link is down at the bottom of both the previous slide and this slide. There are tools that can easily be downloaded. If you look at what's in the green shaded box here, you'll see that it's incredibly similar to the earlier tool that I showed you, the Save Your Life tool. Again, highlighting those most common complications that can lead to severe complications, rehospitalization, and in worst case scenario, death. Another group that is very aligned with the thought of empowering women so that they can be in control of their body and of their condition is the March of Dimes. And the March of Dimes is another wonderful resource for materials that can assist mom with her education, for family members to go to and reference should they have questions. And I'd like to highlight this particular organization because there are many organizations that focus on particular complications of pregnancy. Preeclampsia is one of those complications, which is a common complication. It's high blood pressure that occurs during pregnancy. It can also be a complication of women who have pre-existing hypertension prior to pregnancy. This particular foundation is very attuned to the importance of educating providers in what they need to look for in order to address issues associated with preeclampsia, but also the patient advocacy piece. And in fact, in 2018, they formed another group called Mama's Voices. And this particular group is 100% solely based to help women, teach them and family members to become maternal health advocates. So it's really all persons. There are a number of other specific organizations. Like I mentioned earlier, preeclampsia is just one, but for some of the other common complications, there are organizations such as for amniotic fluid embolism, etc. But I do highly recommend Mama's Voices, though, is the first group that actually harnesses all of these patient advocacy groups and helps to train patient family partners to align all of the advocacy organizations so that the voice can be elevated, as well as educating healthcare providers. As you can see, the Eastern Seaboard is well represented, and I can tell you in New Jersey, we already have maternal health advocates that have been trained through Mama's Voices and are part of different community-based coalitions, hospital committees, so that the patient's voice is heard and we understand what their needs are, which can only lead to better care for our families. Remember Tara's story. Tara shared that something wasn't right before she left the hospital, but everyone there felt that it was just the normal part of postpartum. If you go back and read Lauren Bloomstein's story, a similar, different diagnosis, similar story. And if you read any of the Lost Mother series, which I highly recommend, you will hear the same theme throughout. So empowering women, having a maternal health awareness day where we can focus on this and educate everyone in their respective areas is so important. But we aren't done yet, because we know and we've seen how important this is. And if there's one thing I've learned in healthcare, you can never say something too many times, because as soon as I think we've saturated the market, if you will, and everybody knows something, there's someone who will come up and say, I never heard that before. And as someone once pointed out to me, Robin, there's always a new pregnant person, a new pregnant family that's having this joyous occasion. So we need to be sure that this is an ongoing effort. And I'm happy to say that Pennsylvania last year signed into law a Maternal Health Awareness Day. This year, Texas declared 123 as Maternal Health Awareness Day. Kentucky has done the same, and there are others. But I think what we are most proud of is that we are now looking to have Maternal Health Awareness Day recognized as a national day, as an effort for all of us to recognize the importance of maternal health. So hopefully, I'd like to share with you this short movie that Senator Booker just videotaped for us in honor of this year's Maternal Health Awareness Day.
Hi, everybody. It's Cory Booker, and I'm really proud that New Jersey is standing up and celebrating this annual Maternal Health Awareness Day. It is so crucial and so critical. In fact, on the Senate floor, I announced a resolution really marking January 23rd as National Maternal Health Awareness Day. We have work to do, and I'm so grateful for New Jersey's champions and New Jersey's leaders. I want to thank Tara Hansen Foundation. I want to thank Rutgers New Jersey Medical School, the Robert Wood Johnson Medical School at Rutgers. I want to thank Dr. Joseph Apuzio, and of course, the Central Jersey Family Health Consortium. All of you and more are coming together in a critical way. I'm proud of the First Lady we have in our state, who has been championing this issue of maternal health and lowering the maternal mortality rates. This is something that I feel a sense of urgency about. We in the United States of America should be the best nation when it comes to maternal health, as well as lowering the rates of maternal mortality. But instead, we have what is relative to other countries, a very shameful track record. We have to, we must do the work. And I'm glad that my state, New Jersey, is standing up and fighting to show a way for all states, as well as an international example. We have work to do to get there, but I know we can. In the United States Senate, I'm proud to have introduced the Mommies Act, which is maximizing outcomes for moms through Medicaid improvement and enhancement of services. There are so many practical things in my bill, as well as the actions that we are taking together in New Jersey, that can have dramatic impacts on positive outcomes. We must commit ourselves to those practical, constructive tactics to win this larger effort. I will say this finally: we are a nation that believes in life, liberty, and the pursuit of happiness. We believe in liberty and justice for all. From the epic racial disparities that exist in this area of maternal mortality, all the way to just the fundamental ideal that every child should be born healthy with abundant opportunities and healthy moms. These are critical and fundamental to our ideas as a republic, our ideas as a nation. We are patriots in their pursuit, and we must continue with all of our best measure of devotion to these ideals. So I want to thank you all. I wish you the best. I am so grateful for what you are doing. I celebrate your commitment, and may we truly continue in the work, and hopefully amidst this pandemic, next year we can all be celebrating and talking in person. Thank you.
If I'm not sure how many people in the audience is aware, but we have been very fortunate to have a First Lady that has made maternal child health a priority. And in fact, when she began her campaign 2 years ago for Nurture New Jersey, she actually did that on Maternal Health Awareness Day on January 23rd. So I have to be honest with you. The question is, why is maternal health awareness so important? And hopefully I've shared with you some of the reasons why it is important to engage women, to be sure that they feel that they have a voice in their pregnancy, to increase and empower them in order to share issues as they go through her pregnancy. And hopefully this skill will take them through their lifetime, to make sure clinicians actually do hear what their patients are saying. And if there's a complaint, if there's a concern, they can stop and really hear and address what those issues are. But I think finally, the First Lady really has made it very clear. And our goal here is to make New Jersey the safest and most equitable place in the nation to give birth and raise a baby. And I certainly could not think of a better, very big, audacious goal, but one that we are working on, and I have never in all my years in healthcare seen as concerted an effort with so many partners, and the strides that we are making, that I have no doubt this will in fact become reality. And just this week on Monday, the First Lady shared with us her strategic plan. And if you have not seen this, I highly recommend that you go online, and all you have to do is Google Nurture New Jersey, and it will come up for you both the full plan and at a glance and a summary document. And you will see that the stakeholders are many, they are varied. And this will be a plan that we will be working on for years to come. But the data that I showed you early in the presentation will hopefully look very different in the next 3, 5, 10 years from now. So what can you do? What is your role in all of this? I recommend that you go online and Google Maternal Health Awareness Day, put Rutgers right in front of that. It will come right up for you. There are toolkits available for you. All of the materials that I showed you, PowerPoint presentations, flyers, brochures, posters. What started as a day-long event has gone to a week. And frankly, this should be part of our practice every single day. Engage with those stakeholders that you work with every day. Let them know what you're doing. Make sure, if you have communication channels where you work, where you live, where you pray, where you eat, wherever it might be, share this information with them. Because again, you never know. There was a story shared not long ago from a colleague of mine, and she was talking to one of the staff within their hospital. This was a staff person that had nothing to do with direct patient care, was in environmental services. He heard the information just because he happened to attend a presentation. That information helped change the course of a family member so that there was not an untoward birth outcome. So you never know who you might be speaking with. Take it one step at a time. This all started a few years ago. This didn't happen overnight. But every single day, every single person has made a difference. And I invite you to join us and continue to work towards a better future for the families and children of our state. So thank you for your time, your attention today. If you have questions on any of the materials, how to access them, please do not hesitate at all to contact me. Thank you.